Hello, and welcome to the Meet the Role Advanced Clinical Practitioner video. My name is Paul Wade, and I am an advanced clinical practitioner employed by Partners Health, embedded in Castle Healthcare Practice in West Bridgford, but I'm also the Primary Care Advanced Practice Lead for the Nottinghamshire Alliance Training Hub. So let's discuss what is advanced practice and who are advanced clinical practitioners. Advanced practice and advanced clinical practitioners, these are experienced registered healthcare professionals from a number of different backgrounds who are able to work at a highly autonomous level to a very high level of practice. And the way that is decided if someone is working as advanced practice, essentially they need to show competency across 4 pillars of advanced practice, being clinical practice, leadership and management, education and research. Now, advanced practitioners can be from a number of backgrounds. I myself are from a paramedic background. That is where my registration lies with the HCPC. And in order to be recognised as an advanced practitioner, as mentioned, they need to be a registered healthcare professional, so from a registered background. So nurse, physiotherapist, pharmacist, radiographer, ODP, occupational therapist, things like that. And this list of professions will continue to grow in time. As mentioned, I'm from a paramedic background, so my registration lies with the HCPC. And at current there is no regulation over advanced practice, but that is soon to be coming in under the plans with the NMC. Now, advanced practice is, as the name suggests, at an advanced level, so this is showing a high level of autonomy over a scope of practice, and this is something we'll touch on later on. How did I get here? My journey through to advanced practice, prior to any form of medical or care career, my background was actually, I studied psychology at Northumbria University. I studied a Bachelor of Science and at Northumbria University, and then I studied for a Master's at Edinburgh University in sports psychology. After that, I joined the ambulance service as an emergency care assistant, where after working there for 5 years, I enrolled with the University of the West of England in Bristol and completed a foundation degree in paramedic science. After this, I continued my learning with multiple modules at master's level, so things like advanced practice in clinical reasoning and patient assessment, and also things like practice placement and learning support. And essentially I topped up my foundation degree up to a Bachelor of Science with the University of the West of England. I then became lead paramedic with South Western Ambulance Service, and this was really my first steps into advanced practice, as I was not only working at a clinical level, but I was also embarking with research projects and education. So as part of those research projects, I was having to lead educational sessions, and that can all build up towards my advanced practice. I then moved to the East Midlands Ambulance Service and tried to create the role of advanced clinical practitioner within the ambulance service by gaining my qualifications in independent and supplementary prescribing. Unfortunately, this wasn't possible due to operational pressures and governance issues within the ambulance service. So at that point in my career, I stepped outside the ambulance service and joined primary care, where I joined Castle Healthcare Practice in West Bridgford, who were very forward-thinking in taking me on. At the time, there were very few paramedics in primary care and even fewer working at advanced level. So really, with them being so forward thinking, it really helped shape my role in primary care, and it so far has worked very, very well. So in order to get to advanced practice level, in order to become an advanced practitioner, there are two essential routes. The first of which is the academic route. So that is to study an NHS accredited master's programme in advanced practice. Locally to Nottingham, these are the 6 most local providers that are accredited: the University of Nottingham, Lincoln, Sheffield Hallam, University of Sheffield, Derby and University of Northampton. It's really important that the MSc programmes are accredited, because this provides a level of assurance and equivalence, showing that the master's programmes are equivalent, and they have the right level of curriculum, and the curriculum is appropriate to the scope of practice of an advanced clinical practitioner. And that means that employers and the public can be assured by the level of qualification gained and the place of higher education at which it was gained. As I mentioned, my journey into advanced practice wasn't direct through a start to finish master's level programme. So I gained my accreditation in advanced practice via the NHSE digital badge, and essentially I did that by creating an electronic portfolio of my work. So in terms of my clinical evidence that show that I was working at an autonomous and advanced level clinically, so that with things like observed clinics and assessment, but then also building a portfolio around my work in research. So essentially listing all of the research projects I've taken part in, and looking at things like evidence of my my educational background, so teaching sessions that I have run and things like that. Essentially building that portfolio to show that I have a level of practice that is equal to that of having the masters in advanced practice from start to finish. And that's something that can be done via the NHSE website, the Centre for Advancing Practice, in order to build that portfolio and essentially gain that assurance that I am an advanced clinical practitioner, despite not having sat a master's course from start to finish. Going back briefly to the accredited courses, if someone has studied a course which isn't NHS accredited, but they have studied a master's in advanced practice, they can claim a digital badge in a very similar way, basically to try and claim that course, although not accredited, would show a level of equivalence in advanced practice and would be worthy of accreditation, even if the higher education provider doesn't have the course accredited themselves. Essentially, you can claim it post hoc via the Centre for Advancing Practice digital badge. How does the role of advanced clinical practitioner look in primary care? This is how my day looks in primary care at Castle Healthcare practice in West Bridgford. So as you can see by my daily rota, the majority of my day is taken up with acute on-the-day presentations, and that's down to my scope of practice and my background as a paramedic. If someone was from a different background, if I was a nurse or a pharmacist who was very much more experienced in managing chronic conditions rather than acute presentations, my day might look slightly different. So this is by no means a universal template for advanced practitioners, but purely being from a more acute background, this is how my day works. And in terms of how it works for patients, there's very little difference than if a patient was phoning up and wished to see an on-call GP. A patient would phone on the day with an acute problem, say an injury or an acute infection, and they would be booked into my clinic, basically explaining that rather than seeing a GP, they were going to see an advanced clinical practitioner, but with the reassurance that as an advanced clinical practitioner, I'm able to see those undifferentiated patients and deal with them accordingly. If someone comes in, I'm able to see those undifferentiated patients, prescribe any intervention that's needed. I'm able to fully assess the patient independently. If they require any further investigations, I'm able to arrange that independently, and also follow up those patients independently if need be. Really, the only difference is that if I see something that I am unsure of, if it's something that I believe may fall outside of my scope of practice, then I have the reassurance of that there are on-call general practitioners, on-call GPs in the building, or senior GPs who I can turn to either during admin time or during those clinics if I'm unsure of something, or I want something safety checked, or if I just want a second opinion. As mentioned, my day is very much based around acute presentations in primary care, and this is down to my scope of practice, so there is very much a need for advanced practitioners to be aware of their scope of practice, and this is something that employers need to be aware of also. I see patients from birth to elderly. I also see pregnant and mental health, whereas there will be some advanced practitioners who there are certain populations that they do not see, purely because they do not have the experience or training to deal with those sections of the population. So it all comes down to the individual scope of practice of the advanced practitioner. You can also see from my rota that I have extended home visit allocations, and this again comes down to my scope of practice. Because being a paramedic by background, I'm very used to going into people's homes and dealing with their undifferentiated issues acutely, rather than seeing people who have ongoing long-term conditions that need tweaking here and there. It is within my skill set to see those long-term conditions, but essentially by me seeing the vast majority of acute presentations, it frees up GP time within the clinic, and that's all an important part of being part of the GP team, to take off some of the strain from those acute presentations and acute home visits. As you can see, also I do have a handful of pre-booked appointments, and that allows me to carry out pre-booked interventions such as joint injections or things like epi manoeuvres or challenging phlebotomy that might need to be booked in advance. And again, that utilises my skill set and my scope of practice. Also mentioned regarding the admin in slots, it's important to have a level of supervision and admin time so that I can debrief any issues I have with one of the GPs, and also catch up on any pathology which I may have requested, such as blood tests or x-rays, or even sending out referrals. So all in all, each day contains 25 patient contacts. That does have a little bit of flex in it in terms of if there are more patients I need to contact because of admin tasks, etc. But this is a basic rundown of how my day looks. And as mentioned, it's very similar from the patient perspective of them coming in to see a GP. It's just that my time is mainly spent with acute presentations. So if someone was calling up because they had a query about their long-term condition, they're more likely to be booked in with one of the GPs rather than myself. What more do you need to know, or how else can you help set up the role of advanced clinical practitioner in primary care? This page has been lifted from the Nottinghamshire Lions Training Hub website, which you can see the address for at the bottom. I've also highlighted in green a couple of important parts of the website. The first of which, over on the left-hand side, halfway down, is the Advanced Clinical Practitioner job description and person specification. These are generic documents which can be tweaked to different providers, but provide, again, that assurance and that level of understanding required for the role of advanced clinical practitioner. This way we are able to really bring in a uniformity across all advanced practitioners within primary care. This is very similar to having the accreditation for the masters. Essentially, we want all advanced practitioners to be of the same level, have roughly the same scope of practice, but there will be some idiosyncrasies between them. Up on the right there's also the Advanced Practice Toolkit, which is, as it says, a toolkit for employers to look at the role of advanced clinical practitioner and really know how to be able to set that up and what the requirements are for employers to be able to provide the correct level of things like supervision or CPD, and look at really how the role would work day to day for them. Down at the bottom in the middle, there's also the Centre for Advancing Practice Maturity Governance Matrix, and that really is the instruction book really of how advanced practitioners and the role of advanced clinical practitioner should be governed within primary care. Really good resource for being able to look at that and really audit how the role is set up, and if there are any opportunities for further development, but also providing some shape as to how the role should work. One last thing on this page, down in the bottom right there, the ICS Advanced Practice Network Group. That's something which I run essentially every 4 to 6 weeks. We have a MS Teams meetup with all of the advanced practitioners within primary care throughout Nottinghamshire, and that really is a space of peer support for advanced practice. There are many advanced practitioners who, like myself, are the only advanced practitioner within a surgery. There will be some who work across a PCN, but perhaps they do not have a support network of other advanced practitioners. So this is really just a nice kind of safe space for advanced practitioners to meet up and discuss how things are going and support each other. Obviously, as mentioned, it's really important for each advanced practitioner to have the correct level of support and supervision within their job space, which provided by their employer. But this is a nice extra and essentially keeps all the advanced practitioners in touch with each other, which helps with morale and motivation. And we provide some bite-sized learning as well, which is really useful day to day. A lot of the things I've discussed today can be accessed via the GrowNotts primary care app. This is broken down into sections by profession or practice level. So there's a GP section. All of the R's roles have a section within the GrowNotts app as well. And there's also the advanced practice section. So this is looking at things like CPD events which were coming up and access to those support networks. If you have any further queries, you can contact myself via the NATH communication channels, or you can look up some of the resources through the Nottinghamshire Lions Training Hub website or the QR codes on screen. As mentioned, all the communication channels, if there's any support or guidance that you have any queries on regarding the role of advanced clinical practitioner or advanced practitioner, then please do get in touch with myself, Paul Wade, or contact through any of the NATH communication channels, because we can provide the support and assistance both in setting up these roles and helping with the governance and support throughout. Thank you for your time today.